Hi friends, and now finally I am live today for what I have promised earlier that I am going to come up with analysis of NEET PG 2023. So first of all, congratulations to all of you, and I have got lots of messages regarding the paper and the pattern of questions what they have asked in NEET PG 2023. So, dear friends, first come with the paper. If you go and see to the my Twitter handle, Dr. Niraj Singh for you, where you able to see that at 12:52, just after 50 minutes of examination, I have given some view regarding the paper. What I have written that the paper was mixed variety with overall moderate difficulty level. The paper was moderate difficulty level. ये moderate difficulty level क्यों है? It's not because of the paper, the questions, what they have asked for the intern, for the post intern, and for the repeaters. What I have got messages and I have talked with different aspirants who has appear for this examination. They tell that the questions was repeat. They are not able to tell the topic is repeat or questions is repeat in proper way. So हमारे ट्विटर्स पे ये ट्वीट करने के बाद आप अगर इसको फॉलो करें तो आफ्टर 6 or 7 hours the different groups, different paper articles, you able to find that they are telling that the paper is moderate difficulty. The paper is moderate difficulty as per India Today. If you able to see that Jagran Josh, they are also telling that the paper was moderate difficulty. If you go to the Career 360, they also telling that the paper is moderate in difficulty level. That means you can say that what I have already given on my Twitter handle, the paper is moderate in difficulty. That means paper is not easy, not very tough. That was in moderate in difficulty. If you are following a different coaching organization, different institution, different teachers, different motivator, or then you able to see that they have also post about the same thing. The paper was moderate in difficulty. That was not too easy. That was not too tough. Why I am telling that? This is just because of this will going to decide ranker, or this will going to decide the cutoff level. If paper is moderate in difficulty, that means definitely this year cutoff level is not going to match what you have seen in previous year in 2022. Why I am telling this? This is not because the paper level, this is also because the number of aspirants. The last year, if you able to see that the number of aspirants was 2,05,000, but this year almost the same aspirants are there, 2,07,000. So there was not a much difference between number of aspirants. So actually what going to decide is that is going to decided by the paper label. Okay. Now comes to the paper in some details. You have matched with different forum, different teacher, you are following different coaching organization, they have discussed the recall based question session. But mind it, if you are repeater, then you definitely know the fact what you are going to match. This is not a correct outcome. If you see the last year, the same things was complained by many student is complaining that I have matched 200 questions. As for that, my 150 question was right after deducting the negative, but in the result they are seeing that 120 question is right. So what the recalls coming is as per the student, not by the actual questions paper what NB has given on the एग्जामिनेशन. सो आप जो रिकॉल कर रहे हैं ये रिकॉल बेस्ड है. अब जैसा आप रिकॉल कर रहे हैं उसके बेसिस पर टीचर कोचिंग ऑर्गेनाइजेशन आंसर दे रहे हैं. तो अगर आपके रिकॉल्स में सपोज अगर आपके 500 मार्क्स आ रहे हैं, सपोज इफ यू आर गेटिंग 500 मार्क्स, डेफिनेटली यू आर गोइंग टू गेट लेस देन 500 मार्क्स इन एक्चुअल result. Actual result you are able to get less than 500 marks. So this will be near about less than 50, less than 20, less than 30, but it will never be 500. So keep in mind that. First things. Second thing, if you think about the questions, why I am telling the moderate difficulty. If you seeing the question diarrhea, dementia, dermatitis, niacin, these questions has been asked many times in the previous year examination. But just go to the just same question, diabetic ketoacidosis. This is not for the adult, this is for the pediatric. And the management of diabetic ketoacidosis depends on the condition, the vital status. The resuscitation fluid amount is going to change, and also when going to use the insulin in starting or after the 1 hour or after the maintenance, that is completely different things. So if you think about the easy one, then diarrhea, dementia and dermatitis is easy one, but you think about the tougher one, that is decay. Everyone giving the different answer. If you comes to the pharmacology, every year pharmacology question was direct. Most of the, if 20 question is asked from pharmacology, 16 to 70 question was direct. But this year they have asked in a clinical aspect of the pharmacology questions. You are not going to answer directly. Just for example, the hyperkalemia questions, the answer was spironolactone. But if you come to the anatomy, that was a easy question. But if you again come to the physiology, that questions were overlapped with the pediatrics. Just for example, if you telling about the questions of respiratory distress syndrome, RDS, or just you compare the similar one questions they have asked about the surfactant deficiency, what is going to the surface tension and what is going to the compliance of the lungs. That is similar question. One is asking the lecithin surfactant deficiency RDS, and again asking the mechanism. That question is overlapping. Same things. If you see the topic of vitamin, they have asked different questions for the vitamin aspect, and you able to see that question is asked previously many times. But if you see the only vitamin B1 thiamine, you able to see the clinical aspect of the vitamin question. They are not asking directly. And earlier they are also asking the clinical aspect of the vitamin question. Microbiology questions were easy. Pathology, if you consider, that was the moderate. But if you comes to the biochemistry, they have asked one-liner type of questions. But if you comes to again ophthalmology, they are 100% almost a repeat question from the previous last 2 to 3 year papers. But if you come to the surgery, most of the questions are from the general surgery, not for the systematic surgery. OBG was more in number, But if you come to a single topic where maximum question is repeat, then everywhere there is STD and HIV. So if you come to the PSM point of view, that was not a 100% easy question. One question was type of study where case control, cohort study, retrospective cohort, prospective cohort. That question was really not too much hard, but moderate in difficulty. So overall paper was moderate in difficulty. Now comes to the cutoff part. The what cutoff is going to be this year? If you going to see the last year, if you going to see the last year paper or last year cutoff, that cutoff was after the reductions. I am not telling about the first one. I am telling about the last reduction where you the general cutoff was 201 for the general, and SC ST OBC was 169 marks. That means 50 questions. If you are going to write the 50 questions overall after reduction of negative, then you have passed the cutoff zone. And SC ST question around 40 to 45 questions. This year again the cutoff that is not for your chance to getting in the clinical seat in the government college. I am telling you about the cutoff. Either you are able to uh, get seat through the counseling or not, you are able to, you are qualified for the counseling or not, that is definitely going to reduce. This is not because of the paper, this is because of the number of seats that are going to increase, and also many seats are going to added on. So the cutoff will be around 190 to 200 or 180 to 200 for the general, and for the SC ST and OBC that will be around 150 to 170. So cutoff will be remain same. But why I am telling this, if you see the previous one also in 2019, 2020, 2021, you able to see the cutoff was more than 300 for the general. In 2020, the cutoff is again reduced. In 2021, the cutoff is again reduced. In 2022, the cutoff is again reduced. That means the cutoff trend is reducing each year, not because of the paper, because of the number of seats. Why the number of seats is increasing in most of the private institution or deemed university, and this is and some government institutions. Lastly, that is the most vital, those who are waiting for the counseling schedule. When counseling is going to start, if you able to see the last verdict where the postponement of NEET PG was going on, in that the government has tell a date, that was 15th of July. That was 15th of July 2023. That means going government is going to start the counseling by 15th of July 23. Those who have not completed internship till that date, they will get joining in due courses, because counseling is not a single time process. It round one, state round one, then all India round two, state round two, then mop up counseling, and the stray vacancy. So counseling is around 3 to 4 month process. So in that time, definitely all are able to complete their internship. Okay. Now for the, if you want to see the who are planning for the government clinical seats, you can go and you can able to see on my Twitter handle, Dr. Niraj Singh for you. You able to see that I have written that cutoff there. What should be the safe zone? Why I am telling that? Because it's not like that someone has scored good and someone has scored bad. Most of the student this year, those who have appeared for the examination, the questions was maximum repeat. more than 90% question was repeated. So those who are preparing from their MBBS days, from the third year, fourth year, they have scored very well. So starting 2000, 3000, 4000 rank, the, who will able to choose their branch and choose their also colleges and the city. For that persons, I have given this cutoff. But overall, up to 15,000 or 16,000 rank, you will going to get clinical seat except some branches like medicine, dermatology and radiology. Individual cutoff for the subject and for the colleges, I will coming with the our next video, and about the bond status of the different colleges, uh, where the bond is on paper or really they are going to implement. After the result is going to publish, I will come with that video, so where you able to see in detail. So finally, the analysis part is the paper was moderate in difficulty. For the cutoff to get eligible for the counseling is almost 10 to 20 marks from the last previous year. That will going to reduce but not going to increase. And for those who are just for waiting for their good rank, their score must be more than 600 plus, so that they can able to get their branches in. And if you have match or you have come with the conclusion what you have getting the marks by comparing different recall session, just deduct 40 to 55 marks from that, definitely you are going to come with the final result in the same passions. Okay, so thank you for the watching. If you have any query after the result, ki how I should appear for the counseling, which college I should take, how I am able to cross the difficulty level, is I am going to appear for the all India counseling or for the state counseling, which will be the best for your rank, I will come with that video after the result. So if you have any query regarding counseling or regarding any issue, you can just comment on this YouTube sessions. I will answer in subsequent video. Okay, and those who have scored very well, my personal advice is to don't stop. You have enjoyed 2 or 3 days, but target INICT, because for the INICT the different preparation level is not required. Just go through the repeated topics, and in exams you able to score very well, because very less time is there. So what you have read for the NEET PG, you able to do best in the INICT. Examination application has already been started, so keep in mind. And for your result, best of luck from my side. Okay, thank you so much.